Well, today I'm here once again with Dr. Jeff from Hillside Chiropractic in Elk River, Minnesota. Dr. Jeff, I want to talk to you and get your feedback on new patients when they come in, what they can expect, the process you go through in their first visit, and get a clear idea of how patients can truly look at where they're at and look at where they're trying to get to so you can help them get back to the active life that they want.
Well, the most important part of the first visit is actually to assess what's going on. And that assessment begins immediately. When somebody's up front and they filled out their paperwork and gave us an idea of what's going on, I go up and greet them and bring them back for the first visit. So I'll go up there, shake their hand, bring them back and actually see what's going on. I'll watch their gait, see how they stand up, see if they're leaning one way or the other, how they carry themselves. You can kind of get a good idea of how much pain they're into, if they look on their face, the way they're kind of handling themselves. So the assessment begins right away. Then I'll bring them back and we'll get more in depth as to what's going on, where exactly the pain is, what triggered the pain, where it came from, how long it's been there, how bad it is. You get what's going on, now as opposed to before, what triggers, makes it worse, what makes it better, all that kind of stuff to get a better idea of what the pain is and where it's coming from. And also talk to them about their goals, what they want to get out of this treatment. If they just want to get a quick pain relief, then they're not in the right spot. This is more about getting actually pain relief, but other things. By getting other things, we can improve their lifestyle, improve their activity level, improve their whole health, because they get more active, they get healthier in other ways. And that's ultimately what we're trying to do here. So we also have to tell them that, there's going to be some ups and downs in treatment, and there's going to be some pain involved, and different muscles are going to get sore and stuff as we work them and re-educate them, break up that scar tissue. If they aren't willing to do that, then they're probably not in the right spot either. So after that, we kind of go in there, get them up, get them stand up, see what the range of motion is, check out things that might be relevant to it, depending if it's low back or neck or shoulder. We'll run them through their whole range of motion stuff to kind of see what's going on there, get a better idea of how the joint moves itself, how the muscles are moving, what muscles might be restricted. And then I'll actually get my hands on them and see which muscles aren't moving and see how I can assess how that's going, see if there's scar tissue in there, or if it's just that there's a little tightness there or anything else going on in there. So I can see whether or not there's scar tissue in one muscle, or if it's multiple muscles, or if just that sometimes muscles have to be able to glide upon one another. There's always spots where there's muscles, one going over the other, and they have to be able to shift and glide over the top of each other. You get scar tissue in there, they get stuck, and they can't pull apart. And that's an important thing that without ART, you can't really assess that. You can push on that muscle, put some pressure on there for trigger point therapy, but that's not going to really take care of it. That's not going to make one muscle glide over another muscle. So that's a really important part.